Well, hi everybody. My name is Garrett Schmidt, and I'm the CEO and managing editor of BBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Bridge, and it is called Risk Adjustment Revenue Integrity. Then what? And I had happened to get a little preview of some of the content before on a practice session, and I think you'll be very interested in what's going to be discussed today. So excited to hear from our speakers, who I'll introduce momentarily. A few items of note before we get started. Everyone has joined today in listen-only mode, so this is a traditional webinar format. You don't need to worry about turning off your camera or your microphone. Don't worry, we can't see you or hear you. However, we do want to hear from you, and we're going to have a time for some Q&A towards the end of the presentation. So if you have a question for any of our speakers or just in general, you can use your attendee control module to ask that question at any time. And we'll get to as many as we can. If for some reason we aren't able to get to yours, don't worry. Someone will reach out via email, and we will make sure that we answer your question. All right. Next is this session is being recorded. So what's going to happen is when we're done, when we conclude, you will receive an email, I would say about an hour or so after we're done, and there will be a link to where you can watch the recording, rewatch it, as well as download the slides, and there'll be some other information there too. And that's something that you can review at your own leisure and or share with colleagues and friends, and we hope that you do. So feel free to do that. And then finally, without further ado, wanted to introduce our speakers today. And so with us, we have Mr. Ray Evans, and he is the Vice President of Healthcare Sales with Bridge. Then we have Miss Amanda Brown, and she is the Vice President of Revenue Integrity. And then we have Colleen Giannatasio. I practiced this, and I still can't do it live. I'm so sorry, Colleen. Giannatasio, and she's the VP of Compliance. And she's also the former president of AAPC National Advisory Board. So all these folks have a very impressive CV and history. So can't wait to hear from them. So welcome, guys.
Thanks, Garrett. Appreciate it. Welcome, everybody. Thanks for your time here today. We're going to talk about what we feel is a very important and a very timely topic here today. As the title says, risk adjustment, revenue integrity, then what? Okay, what we feel, here's a few headlines that we've pulled from all the different areas that you see every day. Fraud, waste, and abuse, we feel, is probably the main or the largest driver of the increased cost of healthcare here in this country. That may shock a lot of folks, especially when you're talking cost of prescription drugs and all this other stuff, right? But once we paint the picture for you, I think you'll get an understanding of where we're coming from here. So one thing that we wanted to talk about is about a year ago, I don't know if anybody's ever heard of a couple of data breaches that happened from Change Healthcare. Kinda in the headlines a little bit, and I would venture to say that probably everybody on this call was affected by that. And me and Amanda were talking back then, and I said, you know what? We're going to see a big spike in fraud, waste, and abuse in about 6 months or so. And I got to tell you, not that I'm a Nostradamus or anything like that. You can go to the next slide there, Amanda.
Sure.
We are the vendor for CMS for the Midwestern UPIC region, which is the 11 Midwestern states, right? And the reason why I know that had an effect, not just in our area, but in other across the country, is about 4 or 5 months ago, we hit a milestone where in our jurisdiction alone, we detected $1 billion of overpayments in the trailing 12 months, right? Which is a huge number. But as of a couple weeks ago, we got an update. In just the trailing 12 months as of now is that number you're seeing on the screen, 1.9 billion. It almost doubled in like 5 months. So that goes to show who are the people that are stealing this data. They're bad guys, right? Bad actors. And who are they going to sell it to? Same thing. bad actors. And we're starting to see that. And that's certainly on the minds of us and the minds on CMS as well. With a little guidance, CMS is concerned that we will be looking at approaching $1 trillion of fraud, waste, and abuse that goes undetected in this country this year alone. So keep that in mind, right? And now on the next slide here, I want to put up a number. I want you to think about this number. What does 3 to 10% mean? Again, why we think this is such a huge contributor to the cost of healthcare today. 3 to 10% of every claim that goes out the door in the United States, and yes, from your organizations as well, has some form of fraud, waste, or abuse in them. Let that sink in for a minute. Okay. That is a massive number. Okay. So this is the main reason why this is a very hot topic. And I will tell you, in past years, it wasn't the hot topic, or it wasn't top of mind as much as it is today. So, and it's just picking up steam. So in this presentation, what we're going to do is we're going to, what is our aim, right? What are we going to be aiming to talk about here? We're going to be talking about different types of fraud, waste, and abuse that are out there in the market. You know, how is it going to impact your organization, whether you're a provider group, whether you're an ACO, whether you're a health plan, or what have you? How can you potentially use different techniques or strategies to proactively forecast what could happen to potentially prevent those losses, right? Keeping fraudulent or overpayment claims from going out the door to begin with, or being able to put in a strategy to catch it before it's too late, catch it within, say, weeks or months, as opposed to a year or 2 years down the road, right? How can you overcome those hurdles for data management? That's a big thing, right? We understand all health plans, for the most part, are siloed, different systems, different document repositories, and all of that kind of stuff. And the data isn't being shared. And there's not a whole lot of integration within like health plans to be able, between like your risk adjustment, your revenue integrity team, your SIU or your fraud, waste, and abuse teams, and all of that. And then we're also going to talk about how you can optimize your fraud, waste, and abuse efforts by removing those silos and building an integrated fraud, waste, and abuse program within your organization to include those other areas, the risk adjustment, the revenue integrity, and so on and so forth, so that you can not only identify, but also prevent any of these false claims or overpayments or fraud from happening within your organization. So with that, I'm going to go down. There's another one right here. To do that, to establish a fully integrated fraud, waste, and abuse program, okay, what does that entail? As you look at this list here, take a quick inventory of your organization. Of these things, having a centralized document repository and all of these other things that are on the list, does your organization already have this in place? Now, when we speak at conferences, I'll ask by a show of hands how many people have all of these aspects. And I haven't seen one arm come up yet, except for, and I got to preface it, so your competing priorities 1 through 7, y'all have those. So do we. So, but the other ones, the other aspects there are truly important. And what we're going to hopefully do here by the end of this presentation is kind of explain why it is really important and how you can do that. With that, Amanda?
Yeah, absolutely. Thank you. So we want to start off by just asking a polling question to get an understanding of how confident is your organization in detecting and preventing fraud, waste, and abuse within your value-based care contracts. So I will turn that over to Garrett to kick off the polling question.
All right, you should all see this on your screen right now. And the question is, how confident is your organization in detecting and preventing F, uh, fraud, waste, and abuse within your value-based care contracts? Very confident, somewhat. Not confident, we're still evaluating our capabilities, or we haven't really thought about it. And this is, by the way, we're going to have a few of these polling questions, and these are all anonymous. So feel free to answer, honestly. And we're going to show the results to you here shortly, so you can kind of see where you stack among your colleagues, and kind of a fun way to play along at home. So I think most of the results have come in at this point, and I'm going to go ahead and close it down in about 10 seconds, and we'll move on. Okay, I'm going to close it down at about 5, 4, 3, 2, and 1, and I will show you the results. Okay, Ray, Amanda, Colleen, are you able to see this on your screen? And if you
Yeah.
would kindly read
So
out the percentages, that would be great for those who are
yeah,
calling in.
absolutely. Absolutely. So it looks like we have about 27%, say very confident, 48. It went just at the very end. It was 25% and 50%. So it was really easy percentages. Very confident at 27, somewhat confident at 48. And then we have 6%, 6%, and 12% there that haven't thought about it, which is great to see. And not, a lot of times we'll see a bell curve in this, around somewhere around somewhat confident or not confident being in the highest. So it's good to see that we have some there that also feel very confident about where you are today. So want to talk to you about, I'm not going to explain to you, what is fraud, waste, and abuse. I think everyone knows what fraud, waste, and abuse is, but really want to talk about, as we said, about a comprehensive fraud, waste, and abuse program. And fraud, waste, and abuse costs our system billions and trillions, actually, every year, which negatively impacts operational efficiencies in the end. And as Ray shared, just our 11 states and just the Medicare fee-for-service area, it's 1.9 billion, right? So take that across all of the MCOs and all of the commercial business and really the whole system, and that's where you come up with your trillions. So today, Colleen and I are going to talk through the essential steps of creating a comprehensive fraud, waste, and abuse program so that you are empowered to detect and prevent fraud, waste, and abuse within your organization. And some of those impacts, as we have listed here, I get asked in my consulting and as a leader of, as a chief compliance officer and health plan in the past, as well as running SIUs, why do I really need to invest in an FWA program? Can't we just check the box and do what CMS says or what our state Department of Insurance says, or where we feel is enough to say we're doing some work against fraud, waste, and abuse? But there are impacts to that. And you have to be willing to accept those risks, that if you're not going to put a really comprehensive program in to fight that FWA, that there will be some consequences and some potential impacts. The other thing to think about is today, if you're listening to the constant barrage of news coming out of Washington, especially around HHS, the focus is around FWA. And so health plans, health systems, and really the industry is going to have the pedal pushed around what are you doing and what impacts are you making towards FWA. And so now this topic is very timely around those impacts. And so, cost, there's always the cost piece. And that's not always the most important piece, but it's the easy one, right? It increases cost of care. People understand that these numbers add up. But those numbers add up to premiums, and that just isn't to premium costs that impact the sale of a plan to a group, but it actually impacts every one of us, whether you're on the exchange, whether you're about to hit retirement and go on to Medicare Advantage plan, our underserved populations around Medicaid and the tax implications of that for taxpayers. it all hits back to those higher premiums to members, and some of those members back to those premiums back to taxpayers. Diminished quality of care. If you've got a fraudulent provider, maybe in the cardiology area, or I had a person I know from my childhood. There was a family member who committed healthcare fraud of diluting cancer drugs. Shockingly, it can happen anywhere, and the diminished quality of care that is impactful to that hits our family members and the people we know is highly important. And then there's always legal regulatory consequences, obviously, in the environment today of those really potential regulatory consequences around this. And then ultimately reputational damage. It's really great to have you build for years a great reputation, and it can be tarnished overnight, with whether it's breaches, as we talked about earlier, but also if you've got a big, fraud scheme happening within your organization, or you have, from the provider side, or, from the health plan side, that you have all this risk happening and all of these actions taking place, and you're really not taking action on it. So with that, I want to turn it over to Colleen to really, now that we've looked and talked about this a little bit, speaking of the headlines and kind of what have you seen in the headlines and the news lately in regards to FWA, in addition to what Ray shared with us earlier.
All right, thanks, Amanda. So this one is a big one, and it hit just about 3 weeks ago. It's an operating scheme out of Kentucky that fraudulently billed Medicare and Kentucky Medicaid for over $8 million. This scheme involved 3 collaborators. It was a medical director, a CEO, and the billing manager. They did their healthcare fraud scheme through the Kentucky Addiction Centers, which operates throughout Kentucky. And they falsely billed Medicare and Medicaid for medical services that were not performed or were falsely represented as more complex than the service provided. The doctor, who also served as the medical director, prescribed Suboxone, which is a controlled substance for people with opioid addiction. Here's what happened. The medical director had some credentialing issues. So they conspired amongst each other to falsely bill for services in the name of the medical director's elderly father, who was also a physician. They used the father's identity to bypass the insurance credentialing process. Then, as if that weren't enough, they used the father's DEA prescribing credentials to prescribe Suboxone, even though the father had never even seen these patients. There was pretty heavy penalties with this. Each of them were convicted of 1 count of conspiracy to commit healthcare fraud, 8 counts of healthcare fraud, 1 count of conspiracy to distribute controlled substances, and they each face a maximum of 10 years in prison for each of the healthcare fraud counts, 4 years in prison on the conspiracy counts. And in addition to that, the medical director and the CEO were also each convicted of 2 counts of aggravated identity theft, and they face a consecutive mandatory minimum of 2 years imprisonment. So Amanda, with that being said, what are some of the requirements that we can do to protect an organization from schemes like this?
Absolutely. So with my former compliance officer hat on and an SIU leader hat on, here's some of my recommendations around really the requirements of a comprehensive fraud, waste, and abuse program, and areas that you may want to focus on as you look to improve or build upon the work that you have today. Number one is reporting and documentation requirements in the compliance and regulatory standards. So this is adhering to the industry-specific regulations around fraud, waste, and abuse, right? This is Medicare and Medicaid guidelines, HIPAA, state-specific guidelines and reporting guidelines, and really that's to avoid penalties, sanctions in meeting the requirements, right? Just the brass tacks of compliance. Then it's timely and accurately and accurate reporting. Making sure that you have a system in place that as you identify or potentially identify fraud, waste, and abuse within, whether it's your provider group or a specific provider, or at the health plan side, that you actually take timely action on that. The worst thing you can do is know that there's a potential there, set it aside and go, when I have time, against priority 1, 2, 3, 4, or competing priorities, as Ray said at the beginning. Making sure that you really take action. Many states have requirements around timeliness of reporting, or even in contracts, in a value-based contract of, do you have a self-reporting requirement to a health plan if you're at the health system side, or a value-based care contract? Ensuring that you do that to protect your liability, but also your reputation, as we talked about earlier. Detailed documentation. Having a system and a process in place to maintain comprehensive records of your investigations, any claims analysis, claims investigations, claims audit, any corrective action plans. You can do all this great and wonderful work. As a compliance officer, it's show it to me. I'm also live in Missouri, so I'm the show me state, show me. Trust but verify, and that's how your regulators and your industry auditors are going to look at these investigations or these audits, is looking at your documentation to ensure it is comprehensive. And it also gives you clear evidence, if you do have to take action, that you have done, you've checklists to check off to make sure you've done all the steps, that you have all the right examples there, and that you can take that and then report it appropriately, and you have the proper documentation. And you're not trying to play catch up or feed constant information into the system once it's requested. You have it there at the front end. Data privacy and security. This is the HIPAAs of the world, making sure you have a system that you're monitoring and maintaining any of your audits or investigations and work in that really is taking into account the HIPAA standards, the Part 2 program information around substance use and mental health services and such, and just making sure that you stay in compliant with those pieces. So looking for systems and records, systems of record that can meet those standards. Audit readiness. Being prepared at any point as the regulatory environment around FWA, the fire starts to continue. It has started building and continues to build with the spotlight on FWA. Is really making sure that you're in an audit-ready state around your fraud, waste, and abuse program, and you have all of these documentation pieces, the reporting, and all those things available, and that you have the information available for the retention periods. And that all of it is up to date and easily accessible in light of an audit, just to reduce your audit risk and really your utilization of time, because we all have competing priorities. Audits take a lot of work. And then your internal reporting processes. This is sometimes forgotten, that really as the health plan or the health system is making sure that the proper reporting is happening internally around any identification of potential overpayments, fraud, waste, and abuse information, that is reported appropriately to the executive leadership and ultimately to the board as needed, as well as to your regulatory agencies. And that also helps hold yourself accountable if you have oversight of the FWA program, that you're taking timely action and that you have a comprehensive system in place. And you're also getting structural feedback throughout the organization and improving your program. So with that, I'll turn it back over to Colleen. What else, now that we've walked through that, what other things are you hearing in the news in regards to FWA?
Thanks. So this next one is out of Maryland, and it's Aqua Vision Care. They agreed to pay over $143,000 to resolve allegations that they violated the Maryland False Claims Act by submitting or causing claims to be submitted to the Medicaid program for vision services that were never rendered. And here's the story. There's a licensed optometrist who provided vision services, but you need to know that Medicaid covers a maximum of one examination per year for recipients younger than 21 years of age, and one exam every 2 years for people over 21 years of age. However, this provider was billing Medicaid monthly and sometimes multiple times a month for vision services for the same recipient. To me, I look at this and I say, this sounds pretty egregious. And you may be asking yourself, how can this type of blatant behavior occur? And I would say it's because most of the time, most organizations have data, but they're challenged with how to use that data effectively. So if we go to the next slide, let's walk through a couple challenges and possibly some solutions on using our data intelligently. The first one is the data silos, right? It's fragmented, it's across systems. We don't have that full visibility and insight into the data. So here, the solution would be to implement data integration strategies that bring together your claims, your provider, and your pharmacy data and look at it in a holistic manner. The next would be the data quality issues. Unfortunately, we're collecting a lot of data, especially from a coding standpoint. It's deficient, it's incomplete, sometimes it's completely inaccurate. Other times it might be outdated data that we're not using. This makes it really hard to do any type of fraud detection. So the solution here would be to regularly validate and cleanse that data to ensure accuracy and reliability. Number three, the sheer volume of the data we're dealing with in the healthcare space today makes it impossible to make this a manual process. So here's where we start looking for this advanced technology that we're seeing come out, the AI solutions, using these automated solutions to pull that data together and then couple that with the human skill set, using the AI and the technology and the human piece to make the volume of the data a little bit more manageable. Number four, these fraudsters are intelligent people, right? They're not going to keep doing the same thing over and over because we get smart to that. We're reading these news headlines. Okay, now they're onto us. So they move on to a new scheme. So it's really hard to keep up. So here, again, the recommendation would be to use the data insights, but also the human expertise and the behavioral analysis all together to stay in front of these fraud schemes. The lack of contextual information. If you look at raw data, it's not going to tell you everything you need to know. You need to, again, couple that with the years of experience of field investigators, people who've been doing this work for a long time. Take the data along with that human experience and use it more productively. And organization collaboration. I'm going to expand on this one. It's lack of organization collaboration, not only within our own organizations. I think we've all worked for organizations where things were siloed. There was little to no collaboration, but we need to move outside of our own organizations and bring in other entities, including law enforcement, other health plans. Let's start talking about it amongst ourselves. Bring in the regulatory bodies. Let's learn from each other to help fight fraud, waste, and abuse through understanding and using our data more intelligently. So let's go back to our audience now and ask polling question number 2. Garrett, we'll turn it over to you.
All right. Let's see. You should see the next question on your screen here. This is, what are the biggest challenges your organization faces in managing data for fraud, waste, and abuse detection and compliance? I know all these are probably factors, but if you had to choose one, kind of maybe at the top of the list, is it data accuracy and integrity? Is it insufficient tools or technology for analysis, lack of resources or expertise? Or is it regulatory and reporting complexities? And we've got the results still coming in, so we'll give it another little bit, and then we will share the results. And again, if any of you are joining us later, these are all anonymous. We are doing some polling today, so we're gonna. This is more just to involve the audience, and we're gonna show you guys where you stack among your colleagues. So it can kind of be interesting to see what everyone says here. And I think most of the results have come in, so I'm going to shut it down in 5, 4, 3, 2, and 1. All right, here we go. All right. Colleen and Ray and Amanda, are you able to see the results? And if so, could you read off the percentages for those who are
Sure, and
calling
it's
in?
a pretty even split. So I think we're onto something here as far as the challenges. We have 32% for data accuracy and integrity, 29% saying that insufficient tools or technology for analysis are a challenge, 29% saying lack of resources or expertise, and 26% for regulatory and reporting complexities. Um, Not surprising here. I think data will continue to be one of our biggest challenges. Amanda or Ray, any comments?
Yeah,
Yeah.
every organization has different risks or different competing priorities, or also competing budget items, or just where focus has been. And so it doesn't surprise me that there's kind of an even keel across the responses.
Yeah, it just speaks to there's a lot of challenges to do this work that we're encouraging all of you to do, right? And we understand that. So, and that's what the fraudsters and what the bad actors are hoping for. They're to
Yep.
feed off of that, right? So that's why you got to have your guard up and have all the pieces of that integrated program that we described earlier.
So with that, Colleen, let's talk about some more stuff that's in the news, and why it's so important.
Sure. So I have one more story to share with you, and this one's pretty complex. Um, there's multiple layers. This is pain specialists, and they agreed to pay criminal restitution of over $58,000, a criminal fine of over $81,000, and a civil settlement of $240,000. So it's really important for me to note here that the civil settlement are allegations only, and there's been no determination of liability. But Pain Specialist was owned by a physician who specialized in anesthesia and pain management. And between the years of 2015 and 2020, when this physician was traveling and not physically present at the pain specialist location, they were billing with their NPI number, that National Provider Identification Number, to bill Medicare, Medicaid, and many private insurance plans for services and procedures that require them to be in person and available for consultation. At the same time, between 2014 and 2020, they improperly listed a physician as the rendering provider for services that were provided by a non-physician practitioner when there wasn't even a physician available on premises. This is a clear violation for those coders out there of the Medicare's Incident to billing requirements, and also a violation of Medicaid's requirement that the provider bill under their own NPI number. Clearly, there was a lot of moving parts here and a lot of complexity. Amanda, can you share some of the ways we can predict schemes
Yes,
like this?
absolutely. So when we think about fraud, waste, and abuse, there's multiple ways that we can help our plans and partners and health systems identify fraud, waste, and abuse. Because we get a question of, okay, great, you're telling me there's all this fraud out there, there's all this potential waste or abuse out there, but how am I supposed to find it? I have all these siloed data, all the things that Colleen talked about, and so the having a scheme predicting model of analytics that incorporates all of these key elements is really important, and really can help you get in front of and identify to either prevent it, detect it, or take action on FWA. So the first one is predictive modeling, and this is using that historical data to forecast the potential fraud scenarios before they occur. And that's identifying things like hot spots or big spikes in schemes on a retrospective basis, high-risk providers and members really based on their past performance. Then incorporating behavior analysis, and that's really the monitoring of patterns of behavior and predicting it and helping to stop that early based on behavior. So as we see a behavior start to happen, the system can flag those potential behaviors that we've seen to be FWA in the past, and identify any deviations out of that normal provider and patient behavior really early on to stop that behavior potentially, or at least look into it to see, is this spike in a utilization of a particular code or a particular service or a particular pharmacy benefit actually legitimate, or is it truly a potential FWA issue? Then scenario simulation. I have found that doing scenario simulation, especially with my compliance hat on, of there's a regulatory change coming, or we know in this state there may be a potential change to a benefit in Medicaid. Checking that scheme before it goes live and talking about it not just in your operations team, or maybe the impact in quality or risk adjustment, or how are you going to report on it from your quality standards or whatever it may be, but really taking that scheme and saying, how can this change to a benefit potentially be exploited? And that's when you have conversations with people like Colleen in your coding teams, or in your clinical teams, of where do you see the risks where a provider or a member could take advantage of this benefit change, and what can we put in place today and run these codes and this benefit or this procedure through scenarios of exploitation to identify any risks in that ahead of time, and put monitoring and flags in the system to identify those potential risks before they happen, to kick it out, have somebody else look at it, or have an audit process in place to identify any potential issues early on. And so having a system to be able to do that's really important. Machine learning. Machine learning is this continuous learning of new data to improve and refine on a system. This is where, AI comes in. I hear the AI term a lot, but when you really get down to AI, AI is a lot of machine learning with managed processes, with data scientists seeing what they give the tools things to look at, and it kicks back and they say, yes, it works, or no, it doesn't. People think AI and they think it's going to just do all of these things and make decisions all by itself. And really most of the stuff that's out there today is is machine learning with some pieces of AI making recommendations, but the final recommendation not being taken place until it's been validated. But having those machine learning places in to really look at algorithms that evolve and emerging fraud schemes and changes in industry trends to really give you that secondary view in the back end to make sure you're not missing anything and can be more efficient. Real-time alerts, early warning systems, immediate notifications of, this provider has never had these schemes build, or these codes build ever. And then all of a sudden, almost every patient they've been seeing automatically is seeing the same set of codes being billed, or seeing, maybe a doubling of a specific code. So looking at those alerts and having a system that can identify early warning systems or alerts to identify potential spikes that could be FWA. And then the last one is the preventative actions. So using predictive insights to proactively adjust your business practices and security measures. And that's really tightening your claims review protocols, auditing high-risk providers, revising reimbursement policies, revising standards to really put checks and balances in place. And I know this is an area where Colleen has done a lot of work in the past of really working through to look at where codes or different sets of codes or different types of diagnoses may have risk. So, Colleen, I don't know if you have anything to add to that before we go on to talking about efficiencies.
Yeah, I'm always a huge advocate for coders because coders are kind of the lifeblood that runs through our organizations, and the codes change very frequently depending on the code set. And knowing these and knowing what the changes are going to help you identify the changes in behavior, whether they're just errors by themselves or they're truly fraud. But knowing them and staying on top of those changes is really going to help.
Absolutely. So moving on, as we think about, we've talked about data, we've talked about data analysis, the inputs of the data, the risks and reputational and the regulatory requirements, and then we talk about all of these analytics and what do we need to do around data, right? Data in. But how do you manage this, and how do you really find operational efficiencies in your FWA programs? So really, the best way to really start building and refining is to focus on these areas of your FWA programs. First is an automated fraud detection system. So having a data analysis system that can bring in all of your claims, all of maybe your data, any denial data, appeals data, whether that's at the health system side, what's those utilization management things where no, it hasn't met utilization standards. What are those trends? What is not met? What has been approved? What hasn't been approved? What's paid? What's on appeal? Really taking all that metadata in on top of their claims that have been submitted, or whether it's on the provider or on the plan side, and looking all the current data that's coming in, your data, your case management data, appeals and grievances data, and all those data pieces in to really bring it into an automated fraud detection system that can take all of that data, synthesize that data, and use automated claims review, machine learning, and flagging, and all of those things to really identify potential fraud, waste, and abuse schemes faster, reducing manual reviews. I remember I used to be a FWA team of one, and I did a lot of things on spreadsheets, and I thought I was efficient. But once we really started getting in and bringing people onto the team and really digging into that, at some point, those Excel spreadsheets and the data, there was so much data I couldn't manage it fast enough. And I couldn't keep up with the fraud schemes that was going on, and I was really just chasing FWA at that point. So really makes you quicker in your review time and potential threats, and preventing dollars from going out the door versus trying to chase it back. Integrating an FWA program of then taking that analysis and the fraud detection systems and building it into a case management platform so you can manage all of those claims audits, any clinical review. So if you want to take a deeper dive, you may have, someone call in as a coder, go in and look at it from a coding perspective, but you may want an RN or a licensed social worker or an MD to look at it. And be able to put those notes right in the system. That, I'm looking at this, there's a potential FWA issue here. I've got all the claims, I've brought all that in, we've done the data analysis. Now we need to do a medical review, we need to do a clinical and medical review, we need to do a claims review from a coding perspective. All of that into a system that really can manage and monitor all the workflow processes that are needed to document the investigation or the audit check against that, and have all of that into one place. Then cross-departmental collaboration. I can't stress this enough. There is requirements, around confidentiality of FWA investigations or audits and those kind of things, but really collaborating amongst internal teams, whether that's compliance, internal audit, claims, in the investigations process, gathering all that information, but making sure that information of the outcomes or any potential edits or checks or changes in systems or efficiencies are communicated amongst the organization so that everyone knows the types of information or the types of potential FWA that may be happening, that everyone's aware of it, and then can keep an eye out on it and put other efficiencies in place. And that really enhances your communication and your collaboration, but also quicker resolution of fraud cases and really the prevention of dollars going out the door. Continuous monitoring and reporting, that having a program and a system that can implement all of these pieces, but then also help you in reporting, whether that's self-reporting, reporting to CMS, reporting to a state regulator, reporting back to a health plan, or even reporting internally. Having dashboards that track key performance indicators around your fraud, waste, and abuse investigations or audits, with periodic assessments taking place, or even a risk assessment around your FWA program, that really helps around measurable improvements, reducing your financial losses, and then, just better compliance outcomes. And then you don't want to forget your vendors. So vendor oversight, today we have external reviewers, external coders. You may have, a vendor that does something specific to cancer treatment, or providers that do, delegated for cancer treatment, whatever it may be. Making sure you don't forget your third-party oversight around your vendors. And as you bring in that information, making sure you're looking at that information and synthesizing that. And that's where having a system that can bring all of that data in to synthesize that, so you can see that you may not identify an issue because it's siloed, but the second you bring it together, there's a bigger picture that you start seeing that may include potential things that could be happening that maybe your third-party vendor isn't identifying, or that's happening there that no one's really identified before. And so that also, making sure you're training and educating those vendors on potential fraud schemes that you may be seeing, or areas that you have focused to ensure that you're really preventing and improving operational controls. So that brings me to my third polling question. So I'll turn it back over to you all to answer our question, and turn over to Garrett to kick that off.
Okay, so you will see this on your screen. Is your organization, in your organization, where do you see the greatest opportunity to improve operational efficiencies in the fight against fraud, waste, and abuse? Claims processing and adjudication, data analysis and reporting, compliance and auditing processes, fraud detection and prevention techniques. And again, if you had to rank these, which one would sit at the top? Okay. We'll give it another few seconds for people to bring their answers in. Okay, I think most of you have answered, so I'm going to go ahead and close it down and share the results. All right. Amanda, are you able to see that?
I am. So the greatest one came out as compliance and auditing processes. Oh, no, sorry, I'm wrong. It was data analysis and reporting. Sorry, I looked at that wrong. Data analysis and reporting at 31%. And then compliance auditing processes at 28%. Fraud detection and prevention techniques at 24%. And then last is claims processing and adjudication. And, I'm not surprised by that, right? Data analysis and reporting, it's probably the hardest thing that I think any of us have to do these days, with just the volume, the synthesizing the information, getting it into, really comparing apples to apples and not apples to oranges, and really being able to find that. And then taking all of that and really, again, the compliance and auditing, taking action on it. And so we get that question a lot. And so, we get asked, like, how I'm a small department, or I have this big FWA program at our health system or our health plan. Like, how do we get there? Like, where do we start? What do we need to do? And really, that is, we have here at Covenant Bridge a system called Smart Partner, where really it is fraud, waste, and abuse. It is everywhere. as you can see in the top right corner, and it's all in one place. You can manage all of your fraud, waste, and abuse all in one place. And that's really for bringing in all of your data analysis and reporting, being able to synthesize that. So our system is able to bring in claims information, utilization management, appeals and denials information, clinical information, even charts, medical records, and images. Any of those types of systems can feed right into the system or be dropped in through data transfers to really synthesize that data to improve and build upon efficiencies. Manual processes, sometimes take 2 or 3 people to do it. And when you can really take your people and have your people focusing on taking action and taking the identified issues and taking action on those and preventing, that's a better utilization of your dollar versus trying to manually monitor and do your analytics and manually do your documentation in the system. We have found that there's statistics out there that show for every dollar that a provider, health system, or health plan spends on healthcare fraud, FWA prevention and detection, they receive a $7 to $10 dollar return on their investment. So there really is dollars to be gained from this, and really, in whether that's prevention and dollars not going out the door or being recouped. And trying to pay and chase that, or from a health system side, or from the health plan side, or the health system side, having those dollars go back out the door because a health plan comes knocking after they do an audit or an investigation and say, we received you've been overpaid $300,000 or $1 million. That's really hard to budget against. So putting these operational efficiencies in place with a system that can really monitor and manage multiple things, whether you want something to go through a claims review for coding, you can monitor and manage in the system who's looking at what is the workload of each of your team members, where is an audit or an investigation within a claims review, or for coding review, or a clinical review by an RN or an MD, and you can manage each of those assignments, where they are and what the outcomes are, and run that all the way through to regulatory reporting or internal reporting, and manage and monitor KPIs at a real-time basis. And then going back to the poll here earlier, one of the highest things was lack of resources, and lack of resources, and really how can we get in front of this? And so here at Covenant Bridge, as we shared before, we have a very large book of business that we do with CMS, but we also do fraud, waste, and abuse investigation services, as well as case management, clinical review, or coding review for health systems, health plans, pay providers, and the like. And so with that, we have a national employee network of more than 700 investigators and sitting in all 50 states that can go out and do, whether it's overt or covert investigations to see if a provider's actually in the location, like Colleen talked about earlier. They're actually there, or are they on vacation or at a conference, and so you have incident to billing issues. We can do that type of investigation. We also have a whole team of clinical staff of RNs and other clinicians to be able to do reviews, or MDs to look at claims and medical records, but then also a whole team of certified coders. And so we can help plans ramp up to take action and kind of run with you and walk with you, or facilities or systems to run with you and walk with you of, hey, I've got a lot of potential here. I just don't know what to do with it. We have experts here that can help you, look at those claims, look at those medical records to identify potential FWA, and save and prevent dollars from going out the door. And then, as I said, we really run with you and walk with you. At any point in the process, we can do an assessment of your current program today to say, where are you today and where do you need to be? Or I've had plans ask or facilities ask, here, where am I today and how do I plan for future growth? We can help you in that process at any point of the way, whether that's analytics, engaging clinical reviewers, engaging investigators, or engaging coders. We have that capability that we can, turn that on really quickly. Or if it's the smart partner system to manage your case management of your FWA investigations, or any claims analysis, or conducting your analytics on what your current claims are today, we can do that. And there's a continuous loop of feedback within that we help you refine and build your programs to be efficient and see measurable and successful outcomes of prevention and recoupment. So with that, we have about 4 minutes left, so I will open it up to any questions that anyone may have.
All right. Yeah, we don't have a whole lot of time, but go ahead and ask your question, and we're going to get to as many as we can right now. But if we don't get to yours, someone will reach out via email to answer you. So go ahead and ask it, even if we're not able to get in there. Oh, let's see. The first question is, how do you differentiate between provider error and intentional fraud in your analytics and investigation process?
Do you want me to take that one, Colleen?
Amanda, if you don't mind. Yeah.
Sure. Yeah. So fraud is intentional, right? And so we look to our analytics bring in pattern. Our analytics looks for patterns. We look for spikes. We look for it may be geospatial, where you have a provider seeing multiple members in one location, today, but then this afternoon, an hour and a half away, they're also seeing multiple patients in that location. So how can they be that far apart? And so it'll identify those types of issues where it may be location-based or where the member sits versus the provider. There's lots of analyses that go into that. But at the end of the day, that's where the investigator and reviewer comes in, of taking the analytics, taking other outside data that our system has, whether that's, tax information, company structure, whatever it may be, and taking in outside global information and taking a look at that and then really validating that. The other thing is, from a waste or abuse perspective, are you seeing longer term trends? Is this something that's just an error? Maybe it's a onesie twosie. Maybe it's, not a pattern that when you go back, you may see it for a year or two, or you see it just happening with one member versus happening over multiple members, 4, 5, 6 of the same billing set of codes. So there is some finesse and understanding, and that's where we come in, as really we can help you look through that as experts in this field of identifying what's really an error and what's really FWA.
Yeah, and to add on to that, going back to the title of this, risk adjustment, revenue integrity, then what, right? We have gotten feedback from numerous health plans of we pay for analytics from a vendor, but we don't know what to do with it. We're not getting anything out of it. So you need to have the subject matter expertise to be able to figure out what those next steps would be, right? And that's peeling back the onion. So the other part to that is what we're hearing, the feedback from health plans is, okay, we identify the overpayments, we go claw that money back, and then we're done. We move on to the next thing, right? But to her point, it may not seem egregious, no big deal. we got our money back. Well, what if you peel back that onion and find out that Dr. Smith has been doing that same billing practice for the last 5 years? If you're not looking for it, you're not going to find it. And that's where you're going to find some patterns, and that's where it gets expensive to a health plan.
Or a health
Yeah,
system. Yeah.
or a health system.
Mm-hmm.
Unfortunately, I hate to cut us off because I feel like we're
Yeah.
beginning a great conversation here, but we are out of time, which is great. But if you do have a question again that you would like to ask, go ahead and drop it in now, and someone will reach out to you. Uh, Colleen, Ray, Amanda, thank you so much for a fantastic presentation. There was obviously a lot here, a lot to think about. And we're going to be sending you all a link to the recording where you can check that out and rewatch it at your leisure and download the slides from today's presentation. But as we close out, I would like to encourage you all to head over to vbcexhibithall.com, which is where you can check out the Covent Bridge virtual exhibit booth there. And there's a lot of great information about them if you wanted to take a little deeper dive and kind of read up on what they're doing in the space and of course, reach out to them through there. But if you would like to reach out directly, feel free to do so. Man, if I could have you go to the very last slide here.
Oh, yep. Sorry.
And
There you go.
no, you're fine. And yes, Ray's, Amanda, and Colleen's information is on here, and so feel free to reach out to any of them directly, or to me. I'm happy to facilitate an introduction as well if that's easier for you.
Yep.
But wanted to thank you all again for a fantastic presentation. Thank you all for joining us and spending your afternoon with us, and we hope you join us on the next one. So until then, have a great rest of your day. Bye bye.
Thank you.
Thank you.